Hi there! So I created this video to share some information with you about mental retardation, a neurodevelopmental disorder, which is now referred to as intellectual disability or ID. ID is diagnosed using the 5th edition of the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, known as the DSM-5 criteria. 3 criteria must be met. They include deficits in intellectual functioning such as abstract thinking, academic learning, experimental learning, judgment, nonverbal and verbal reasoning, planning, and problem solving, and these are confirmed by clinical assessment as well as individualized and standardized intelligence quotient testing. An IQ score less than or equal to 70 to 75 indicates significant intellectual impairment. The second criteria is deficits in adaptive functioning, which inhibit the individual from meeting developmental and sociocultural standards and further prevent the individual from obtaining personal independence and social responsibility. There are 3 domains of adaptive functioning. The conceptual domain includes skills of knowledge, language, and memory. The social domain includes skills of empathy, rule-following ability, and social judgment. And the practical domain includes skills of daily living, organization, and self-care. The individual must display deficits in at least one of the domains. The deficits must affect the individual's involvement in multiple everyday settings, and they must require ongoing support. The third criteria states that onset of deficits occur before the age of 18. Because both intellectual and adaptive deficits are required for the diagnosis of ID, if an individual has a low IQ but lacks adaptive impairment, he or she would not be considered to have ID. ID is typically caused by abnormal development of the central nervous system or by an insult to the brain either before, during, or after birth. Potential causes include maternal substance abuse with alcohol or drugs, and I included a picture of fetal alcohol syndrome as it is a common environmental cause of ID. Maternal infections, which include the torch viruses of toxoplasmosis, other viruses such as parvovirus B19, syphilis, and varicella zoster, rubella, cytomegalovirus, and herpes simplex virus. Maternal medications such as phenytoin, which is an anticonvulsant, and isotretinoin, which is a retinoid. Trisomy 21, also known as Down syndrome. Genetic abnormalities comprise the majority of known causes of ID, with trisomy 21 being the most common genetic cause, and trisomy 21 occurs in roughly 1 of every 700 live births. Sex chromosome abnormalities, such as Fragile X syndrome, which is the most common inherited cause of ID and affects roughly 1 per 5,000 males, Klinefelter syndrome, and Turner syndrome. Autosomal dominant disorders, such as neurofibromatosis and tuberous sclerosis. Autosomal recessive disorders, with a number listed here, and some of which are metabolic disorders. Perinatal factors such as birth injuries, perinatal anoxia, and prematurity. And postnatal factors such as childhood diseases. Examples include encephalitis, hypothyroidism, meningitis, and seizure disorders. Poisoning. Examples include carbon monoxide, household products, lead, and mercury. Severe deprivation or neglect. And trauma. Examples include accidents, hypoxia, and physical abuse. The epidemiology of ID. Roughly 1 to 3% of the United States population is affected by some degree of ID. Roughly 85% of people with ID have mild ID. Roughly 6 per 1,000 people are affected by severe ID, and males are affected by ID more commonly than females, with a male to female ratio of 1.6 to 1 for mild ID and 1.2 to 1 for severe ID. The DSM-5 categorizes the severity of ID as mild, moderate, severe, and profound. The severity of ID is determined by the individual's level of impairment in adaptive functioning rather than his or her level of impairment in intellectual functioning. This is because the individual's level of adaptive functioning correlates to his or her level of required support. With mild ID, these individuals are slower in all aspects of conceptual development. Children require support academically to learn age-related skills, and adults may struggle with academic learning skills such as money management, planning, and reading. Personal judgment and social skills are immature for the individual's age. These individuals are often gullible. These individuals are able to learn practical life skills, therefore most gain independence with activities of daily living and personal care. Most can live independently and work jobs that necessitate simple skills, but most need some support making decisions regarding finances, healthcare, nutrition, raising a family, and shopping. With moderate ID, children's academic and conceptual skills fall well behind those of their peers. Adults' academic learning skills are generally of a grade school level, and complex tasks require substantial support. These individuals have impaired communicative and social skills in which they use simple spoken language. Social cues, decisions, and judgment, as well as life decisions, need regular support. Most individuals can perform activities of personal care with moderate support and sufficient teaching, and some may be able to work in a supported environment. With severe ID, these individuals have minimal understanding of money, number, and time concepts, as well as written language. Problem solving requires extensive support. These individuals use basic single words and gestures or phrases that are relevant to their present situations. These individuals can be taught certain fundamental activities of daily living, but they need significant and continuous support and supervision. With profound ID, these individuals may use physical objects rather than symbolic processes and goal-directed behaviors for recreation, self-care, and work. These individuals have very limited understanding of symbolic communication. Some may be able to understand a few emotional cues and gestures in which they express themselves nonverbally. These individuals usually require support for all activities of daily living, and they typically have physical and sensory limitations due to having co-occurring medical conditions. Here are the ICD-10 codes. It is important to specify if the individual's ID is associated with a known medical or genetic condition or environmental factor by coding the associated condition or factor. Developmental and behavioral screening should be performed at the 9, 18, and 30-month visits and anytime a clinician or parent has concerns about the child's development. Additionally, screening for autism spectrum disorder should be performed at the 18 and 24-month visits. Commonly used developmental screening tests include the following, and commonly used behavioral screening tests include the following. Although these tests can be useful for identifying children with ID, the diagnosis of ID, as stated earlier, must be made based on individualized and standardized tests which are customarily administered by a clinical psychologist. Such tests include the ones depicted in this chart, with the Wechsler scales being the most commonly used tests for children. These tests compare the child's measured performance to what should be expected for his or her age. Comprehensive tests, rather than abbreviated or brief tests, are recommended for the initial diagnosis of ID. Test selection should take into account the age, communication, culture, disability profile, language, and socioeconomic status of the child and be suitable for the level of functioning demonstrated by the child. If the test is suggestive of developmental delay, a thorough developmental and behavioral evaluation should take place. This includes a comprehensive history with a 3-generation family pedigree and a comprehensive physical in which height, weight, and head circumference are measured and neurologic and dysmorphology assessments are performed. The child should be referred to a developmental pediatrician, a pediatric neurologist, and/or a pediatric psychologist. A child psychiatrist can be utilized if there are psychiatric comorbidities, an occupational therapist and a physical therapist for assessment of functional impairment, and a social worker for assessment of child and family needs as well as for resources to social supports. A detailed school-based evaluation should be performed if applicable. A genetic evaluation should be performed if the child has unexplained ID or global developmental delay, which is the term used to describe intellectual and adaptive impairments in children under the age of 5. The child's communication, language, and speech should be assessed, and the child should undergo hearing and vision screenings. There is no specific pharmacologic treatment for ID. When medications are prescribed, they are targeted to treat associated or underlying medical conditions. Psychostimulants, such as methylphenidate hydrochloride, for example, are commonly prescribed in this population, given that many individuals with ID also have attention deficit disorder with or without hyperactivity. For neuropathic pain, acetaminophen or NSAIDs can be prescribed for mild pain. Tramadol or an alternative can be prescribed for moderate pain, and opioids can be prescribed as indicated for severe pain. Early identification of ID is necessary for early intervention services, such as behavioral management programs and special education programs, which should be considered based on the child's abilities and needs. It is also very important to develop a comprehensive management plan that includes the input from multiple disciplines. That concludes my video. Thanks for watching.